So I'll move on. I've noticed Terry walked in, so I'd like to introduce Terry Symonds. I'll make sure I get your title, Terry, right, because it does change weekly at the moment. So Terry is the Deputy Secretary of Health and Wellbeing Division in the Department of Health and Human Services. So I'd like to welcome Terry to give us some final reflections. Thanks, Terry. I'll just get you a microphone. Got one? Great.
Thanks very much. I'm really sorry I wasn't able to be here for the day. It sounds like an amazing day. I did have a chat on the phone to someone who'd been here this morning and they reported what an amazing experience and stories they'd heard. I'll begin by acknowledging that we're meeting on Aboriginal land today, and I want to pay my respects to the Wurundjeri people of the Kulin Nation and elders past and present and elders of any other communities that are here today. I'm also obliged to acknowledge that our department's lost one of our amazing ministers this week, and I'm sure you will have heard people speak during the day about Fiona, but I feel the need to kind of just record that again for you, that we've lost our Minister for Women, we've lost our First Minister for Prevention of Family Violence, and she's responsible for Victoria's first gender equality strategy. The meeting of the Advisory Committee on Gender Equality was yesterday. It's kind of instructive, I think. There was a moment, I suppose, on the night before when we all heard the news and sort of debated and wondered whether or not the Advisory Committee should or could proceed. But it only took a moment, really, to realise that the last thing that Fiona would have wanted was for that committee not to meet and proceed and continue with the work. And I think it's in that spirit that I'd like you to kind of think about her today. It's the best single tribute we could make, I think, to her legacy as a minister that we're meeting today and continuing to do the work around this initiative and so many others that are about prevention and responding to family violence. I might also add that Fiona was a local member for my family and visited the school, and I think we're going to hear a lot about her legacy in terms of family violence, but let's remember also she was a great local member and a big part of her local community on the north side of Melbourne. So to turn to the day, you certainly don't need me at this point in proceedings to tell you how important you are. The health sector has the burden and privilege, I think, of being outside of schools, the largest universal non-stigmatising system that we have for contacting and responding to families and individuals in need. And schools only have that contact for relatively brief windows, whereas the health system goes in and out of contact collectively with people across the course of their lives. It is a burden and a privilege. I think the Royal Commission heard that something like 80% of victims make their first contact with the health system, primarily through GPs or emergency departments, and you will have heard people talk during the day about that, and it's why you're all here. It's not just family violence. I guess I'd like to, at this point, to situate your work in a broader context. It was brought home to me by a statement, a bit of testimony that I read this week. Actually, it wasn't from this week. It comes from a doctor in the US. I'll just read this out. She says, "I diagnosed abdominal pain when the real problem was hunger. I confused social issues with medical problems in other patients too. I mislabelled the hopelessness of long-term unemployment as depression, the poverty that causes patients to miss pills or appointments as non-compliance. In one older patient, I mistook the inability to read for dementia. My medical training had not prepared me for this ambush of social circumstance. Real-life obstacles had an enormous impact on my patients' lives, but because I had neither the skills nor the resources for treating them, I ignored the social context of disease altogether." That's a statement from Laura Gottlieb, who's a US doctor and academic. But I think it's relevant to your work today because I think what we are doing is retooling the health system so that it isn't treating only symptoms and presenting problems, but actually beginning that response to people's whole experience and appreciating that our health system is in a privileged position of being the point at which those people are going to first talk about, first discuss, first kind of consider how they might seek help. So we have an incredible opportunity. It also brings with it the need to support our own workforce, and I caught some of the comments from the last discussion, and I won't add much to that. I want to congratulate, I think it's the Royal Women's and Benalla who've become white ribbon workplaces, our departments on the journey to do that ourselves. And a big part of it, I think I echo the comments of the previous speaker, that it's not only about supporting victim survivors, but also supporting the managers and staff around them to support those victim survivors as well. And those people don't necessarily have the skills and experience to do that, and they may become aware of the experience of staff but not know how to actually respond and support and deal with that. So training the whole workforce is a very important part of the journey, I think. Obviously, I want to congratulate the Royal Women's and Bendigo and Sue and Liz and their teams for the work that's been showcased here today. I also want to finish by just acknowledging we have a terrific bunch of ministers. We're very lucky, and the ministers collectively have been very supportive. It's not just been Fiona, but Minister Hennessy for driving the work in terms of the hospital response in antenatal care, as well as through this initiative. Minister Foley also has initiatives in the mental health space, and Minister Erin is thinking about how sports associations also can be more responsive. So, and Minister Makakos was obviously here this morning as well, and she has joint carriage for many of the recommendations from the Royal Commission. So we have a terrific portfolio of ministers who are united in their stand around how to prevent and respond to family violence across the entire continuum of services that our department looks after. So we're privileged in that regard as well. Some other thanks. I want to thank the Project Advisory Group. I want to thank the teams at our department in the Trauma and Emergency team and the department more broadly who've been part of supporting this as well. And I want to just thank all of you. I think I heard stories about, I think it's Katie, was the person who spoke today, and I heard it was a really kind of moving story and experience that she shared, but also everybody who's participated in what looks like a terrific program during the day, and so many of you kind of still here at this point in proceedings. So thanks very much for all of your work today, thanks very much for all of your work back at the Health Service, and look forward to hearing about that as we go forward. You really are doing the most important work I think the health system has to offer right now, so thank you.
Thank you very much, Terry, and thank you for making the time to come today. I think we are in a very fortunate position with this government to have a very authorising environment for this sort of work, which is very positive going forward. So it looks like we're slightly ahead of time, which is great, so we will finish on time today. So I'm just going to wrap up with just reminding people that this is, to take five, I guess. This is a difficult issue that can take a toll on us individually. And so I really encourage everyone and also to support their staff and colleagues in taking five to reflect on how hard this work is and to look after themselves as well. So just to wrap up, there's been a lot of interest in the 1 in 3 book with poems. So we're going to send something else out about that. There is only one book available, so they're looking at how they might be able to produce that. So we'll send out some information to all the people here today if you, as a follow-up to see if we're able to make those available. So I'll just check that. So again, just on behalf of everyone, we'd like to thank you for coming. On behalf of the Women's, Bendigo Health and also Peter McCallum, we thank you for coming and we hope you found it a very helpful day. This is just beginning. Obviously stage 4, there's a lot of work coming, so hopefully you'll all engage going forward and we'll have a number of opportunities to continue to discuss the really important work we're doing. So thank you to all the facilitators and presenters today, and also for everyone's time for staying. There's been a huge number of people staying for the full day, which is a really a great example of how important this work is. So the toolkit is now available on the website. Really encourage you to go and have a look at that. There's been a lot of work in there from a lot of health services and it is a really fantastic resource. You'll already notice in your emails, if you've had a chance, that the survey is out for evaluating today, and we really appreciate your honest feedback so that we can make next year's event even better. And again, just a final acknowledgement of Minister Richardson's passing and her contribution to this work. Thank you.